Welcome, everyone. We're really thrilled you're joining us for tonight's presentation, where we're going to talk about Medicaid, Social Security Disability Insurance, and Social Security Insurance. It's a lot. We've got a lot of information we're going to be sharing with you, but we're very excited that you're here with us tonight. So before I begin, let me introduce myself. My name is Lisa Math. I'm the co-director of the Family Star and United Families for Children's Mental Health statewide programs at Family Network on Disabilities. I'm also a certified recovery peer specialist, so I have professional training along with my personal lived experience as a parent of a young adult with both medical and mental health challenges. So I've had a lot of opportunity to learn about the systems, about the programs, and to use that to help support families that we work with at Family Network on Disabilities. So a little bit about our organizations. Family Network on Disabilities is a 501c3 nonprofit. We operate throughout the state of Florida, and we help families, professionals, providers, and educators in their journeys through the systems of care. And we are funded in part by the Department of Education and the Department of Health and the Health Resources Services Administration. What makes us unique is that we were started as a grassroots movement back in 1985 by a group of parents who were struggling to get resources for their loved ones with disabilities. And so 35 years later, we are now well-known, well-respected, and statewide. So what started out in somebody's living room is now in everybody's living room in Florida, and we're very excited and proud of that. And another part that makes us very unique is the fact that we are a peer-run and family-driven organization. So from the top down, and from our board of directors, having many of them with lived experience or family members with disabilities, our frontline staff, our leadership team, and our management team all come from that peer perspective, where we're really using all of our experiences in raising these children to help support your journey as well. I do need to just clarify that we are not doctors, attorneys, or mental health clinicians. So with that, we are not able to give legal or medical advice, but we are certainly here to support your journey at no charge in offering support, information, resource linkage, and trainings just like this. So with that, let's get started. We got lots to learn today. So we're going to start with Medicaid so that I can go through this so you'll understand how we're going to navigate. We're going to start with Medicaid. I'm going to talk about Social Security Disability Insurance and then Social Security Insurance. So we'll separate it up a little bit and then you'll see the similarities as we go through. So what is Medicaid? Well, Medicaid is a federal and state program. So it's operated by both the federal agency and state governments. And it provides medical assistance to individuals based on eligibility. Individuals must meet criteria, and it's very technical, so you have very specific protocols that have to be met. And there is an income test as well for the coverage group that you're going to be added to. Funding comes, as I mentioned, from both the federal level and the state level. And unfortunately, in the state of Florida, they did not expand the Medicaid program. So there were many areas and groups of people that were not covered when the federal government extended the services and dollars to the states. Our services for Medicaid in Florida are administered through the Agency for Healthcare Administration, commonly called ACA, which is the acronym for that. And it is determined by the Department of Children and Families or the Social Security Administration, depending on whether or not you're receiving other social government services. We are going to be sharing some resources down the road and links for these resources, but I want you to know that most of this information can be found at www.myflfamilies.com, and we will put that in the chat box as well. So there are groups of individuals that may be eligible, and we'll talk about those special circumstances as well. So the Medicaid regulations are this, that coverage is only approved for 12 months at a time, and that to continue receiving coverage every year, you must have a review to determine whether or not you're still eligible, obviously. And then that if you have any changes in either your income levels, your job situations, your family status, or the disability itself, that has to be reported to Medicaid in order to be reevaluated. So changes in family status and situations might include birth of a new child, a pregnancy, obviously we're talking about the parents or the caregivers in this case, receipt of new or increased earnings, termination of employment, arrival or departure of members of the household that were currently being included for those counts, changing in your living arrangements, your address, because that may change what your benefit package would look like, and whether or not you're relocating to another state. Once again, the Medicaid services, although they're administered federally, do not cross state lines. So how do you apply? You're going to start by accessing what is called the My Access account, and it stands for Automated Community Connection to Economic Self-Sufficiency. It's a mouthful, and that account will need to be open in order to apply for the programs and to adjust your benefit programs as needed. And by registering on the website www.myflorida.com/accessflorida, you will be able to get all of this information. Any changes and renewals will be also done through that portal. So here are the different ways that you can apply. There's obviously online through a computer. You can do it in person at the Department of Children and Families or their service centers, depending where you live. You can locate a community partner that has options to apply through them, and some of those are listed as well on the Access website. You can do it in person. Now, of course, you're going to want to call and make an appointment because, needless to say, you don't also by phone. And as you can see on this slide, the agents are available Monday through Friday, 7 a.m. to 6 p.m. Eastern Standard. The number is 850-300-4323. I encourage you to take pictures of the slides if there's information you would like to collect. So you've applied on the website. What happens next? Well, there's actually 4 steps. The first step is the application is going to be reviewed to see if you need an interview. If you do need an interview, you'll be called within 5 days at your phone number. And if you can't be reached, they'll leave a message and send you a notice. So they'll make sure that you have been contacted in numerous ways. During the interview, you're going to be asked questions about your household situation. So how many people, what's your income, what are the job levels, and so forth. You may also be asked to verify your identity. So that may mean you have to have some backup documentation that you'll have to present. Once they've done that initial application review and that interview, they're going to contact you if you need additional information provided to them. So this might be proof of identity, citizenship, or non-citizenship status. Say that 3 times fast. You may have to show proof of earned or unearned income for each member of your household, such as if you're receiving income from any type of disability payments or veterans resources, or even if you were in an accident and you got some kind of settlement. So all of that information may be requested once you've made your application. And they will give you a specific deadline for that information to be submitted. So make sure you adhere to these deadlines. They're really critical because you could lose your opportunity to get services and benefits. So you will send those documents to where they ask you to send them. Once that application is processed, it may take 30 days. You'll have to be a little patient. Sometimes it may take longer depending on if you're also eligible for disability through Social Security. You can sign up for email notifications at the My Access account that you've now created, and they will let you know the status of your application. Once you've been determined eligible to receive Medicaid, you will receive a Medicaid card in the mail for all those members of the household that are eligible. It takes approximately 2 to 3 weeks to get the Medicaid card after you've been approved, so be patient. Again, as we know, we all have to be patient when we're dealing with government services and benefits. And if you do need immediate proof, for example, you may need to see a doctor or provider before the card arrives. Again, by going to that My Access account, you can print a temporary card and you'll have it until your regular card arrives. So I mentioned earlier that there are special groups eligible for Medicaid, and these include several, as you can see. So I'm going to go through each of these. The first is medically needy. So the medically needy program can help pay for Medicaid covered services for individuals enrolled in that program who have income or assets that exceed the limits for regular Medicaid. So this is kind of a subset of the Medicaid population. In other words, they don't qualify for Medicaid, but because of their income, but they're eligible for services, for Medicaid services, and you would be notified if you fit that category. Then we have the non-citizens and emergency Medicaid. So this is for non-citizens in our country who meet the eligibility requirements except for citizenship status. So they are eligible to be covered for any emergencies, including the births that may happen while they are in the country as a non-citizen. The third category is presumptive Medicaid. So this is usually determined by healthcare providers and Head Start programs who are working with these families. And they are the ones that will determine if the family or the individual is eligible, and they will enroll these uninsured children through this eligibility, this presumptive eligibility category. Some of the organizations that do this are some of the schools, community-based organizations, and healthcare providers. And they also not only screen for Medicaid, but they check to see whether or not the family is eligible for the Children's Health Insurance Program, which is the CHIP program. The last one is Medicaid access through SSI. So those individuals who qualify for Social Security insurance or the SSI Supplemental Insurance Company, Supplemental Security Income Program, is automatically going to receive the Medicaid through that. So if you are determined eligible for SSI, you will automatically get Medicaid and you will not have to apply independently for it. Again, this is all based on income and assets. So that whole process of applying, whether it's through SSI or Medicaid, will require for you to provide information and documentation. So what happens if you're denied? Well, there are specific steps in this process with Medicaid, as well as SSI and SSDI, and we'll go over those in a minute. So the Office of the Inspector General is actually the one that conducts the administrative hearings on behalf of the Department of Children and Families when there is an appeal that is submitted. Everyone has a right to a fair hearing, and you have the right to request it by either going to your local DCF office, calling the customer care center at the number on the screen, or emailing the appeals hearing section at that email address. It's really critical that once you make that application for the appeal, that you follow those guidelines to the T and that you follow the deadlines. If you miss a deadline, you will be probably denied your appeal. I'm going to pause for a minute in case any of you want to take a picture of that slide. And I can always go back if you'd like for me to and share slides with information. So that's a little overview of Medicaid. So now we're going to segue into the Social Security Disability Insurance and the Social Security Insurance Programs or supplemental insurance programs. They are very different, and unfortunately sometimes we tend to use the terms interchangeably, but they are very different programs. So the two programs are defined this way. Social Security Disability provides benefits to disabled or blind persons who are in these contributions come out of our paychecks. If you look at your paycheck and you see the Social Security and they taking out a certain amount each paycheck, that's where that money goes. So you actually have to earn work credit before you can collect on Social Security Disability Insurance. And we'll talk about that in a minute as well. These withdrawals from our paychecks are actually required by the Federal Insurance Contribution Act. And it is part of Title II of the Social Security Act that authorizes these benefits. So your dependents are actually eligible based on how many years you have worked and how many credits you have earned, work credits. And that's what they mean by insured. So it's not that you're buying insurance, it's that each year that you work, you are creating this bank of work earnings. that you can apply to your disability coverage and how much you'll receive. The second one is the supplemental security income. So the SSI program makes cash assistance payments to those that are blind, considered disabled, or are considered elderly. As we know, Social Security usually is associated with 65 and older, but this program also works with the disabled population. Again, it's for those who have limited resources in income. So it's adding to what they have, which is why it's called supplemental. And this comes from tax revenues also that we are having withdrawn each month. The Title 16 of that Social Security Act is the one that authorizes this. So they come from two separate sections of the Social Security Act in the federal government laws. The Social Security Disability Insurance and the programs that provide assistance to people with disabilities. And while they're different, they're both administered by the Social Security Administration. So let's get into each of them. So let's start with SSDI. So moving forward, I'm going to call it SSDI because it tends to get tongue twisting after a while. So bear with me. Okay, so how do you qualify for SSDI? First of all, you must have worked in a job that is covered by Social Security. So again, if you have Social Security benefits taxes being taken out of your paycheck, you have now created those work credits. And in order to qualify, obviously you must have a medical condition that meets the definition of disability. And we're going to talk about that on the next slide. Generally, monthly benefits are paid to the people who are unable to work for a year or more because of that disability. So the first thing we need is to meet that definition of disability, which we're going to talk about. And the second is that you must have worked in a job that is getting benefit from the Social Security taxes. So how does the Social Security Administration define disability? Well, first and foremost, it's different than any other form of definition. So they have their own definition. They do not pay for partial disability or short-term disability. So that's very strict and unfortunately impacts a lot of people because when we think about partial disability, it can be very hindering to a person's lifestyle, but that's not how the Social Security Administration sees it. So there is, as I mentioned, this strict definition. Social Security program rules assume that working families have access to other resources to provide support during periods of short-term disabilities, which is why they will not cover it. And generally what they're talking about is maybe workman's comp or some form of insurance that you may have if you have a disability policy of your own, or if you have a savings account or investments that can help support you if you have a short-term disability. So if you have that environment, you are not eligible for SSDI. So while filing for SSDI, it's important to note that the diagnosis or condition is not the most relevant thing that SSDI is looking for, believe it or not. They're actually, in fact, looking for how that disability or condition affects your ability to function in everyday life, how it affects your ability to gain, attain, maintain employment, and how it affects you in specific activities. So I will give you also a heads up that if a child does qualify for SSDI under the age of 18, it does not transfer the criteria as an adult, and the criteria for an adult is very different. So many times children that qualify for SSDI do not get it as adults. And it's really overwhelming sometimes for families to learn that. And as you can see on the slide, they also want to make sure that your disability has either lasted or is expected to last for at least 1 year or to result in death. Unfortunately, that's part of the protocol to receive this SSDI. So there is a 5-step process to determine your eligibility. Similar to what we had with Medicaid, there was a 4-step process. So the first is, are you working? If you are working and your earning averages more than a certain amount each month, then you will not be considered disabled. So again, remember how I said that your disability is not the main criteria for what they look for. They are truly looking to see whether or not you're able and capable of earning a living. And when they say earning a living, remember, that's not being a professional, necessarily CEO. If you're capable of working in a fast food restaurant or boxing in an environment of a warehouse, that is considered employment, and they may not see you as disabled. The amount for disability changes each year. They generally give cost of living increases. If you are not working or your monthly earnings currently are more or less than equal to or less, then the state agency is going to take it to the next question. And is your medical condition severe? Well, how do they define severe? Well, for the state agency to decide you're disabled, your medical condition must significantly limit your ability to do basic activities such as walking, sitting, and remembering for at least 1 year. If your condition is not that severe, the state agency will not consider you disabled. Remember what I said, that it's not your disability they're looking at, it's whether or not you can function day to day. So if your condition is severe enough to meet that criteria, then they're going to go to step 3 and wonder whether or not your medical condition is on the list of impairments. So they have a prescribed list of impairments that every state recognizes that is defined as disabled. So in other words, there is a list of, and I think it's about 150 conditions that the Social Security Administration has created to say, yes, we will fast track these conditions to label them disabled to receive benefits. That list changes based on input from state agencies, government agencies, community organizations, and medical professionals based on what new diagnoses might become available, because as you know, medical diagnoses change all the time, as do mental health diagnoses. So if the state at this point does not think you're on that list and they still think you may qualify, they're going to go to question number 4. Can you do the work you did before your disability started? So this is at the point where the state is going to decide if your condition prevents you from doing work you did and at the same level you did it. So remember, if all you did was work in a warehouse folding boxes and putting them on a shelf, and you are still capable of doing that even with your disability, you will not be qualified to receive disability benefits. It's really hard to prove disability under this particular parameter. If at that point you are not able to do the work the same way you were able to do it before, that's when the question on the last number 5 comes up. Can you do any other work and still function? So this is where they'll say, okay, if you can't do that, can you do this? And they will assess you. Sometimes they'll have people come in and evaluate your medical condition and do some tests to see what you are physically capable of doing. At that point, if they feel that you cannot meet the criteria of doing additional work or some other work that you can do on a regular basis to receive income, then they will decide you are disabled. A lot of hoops to jump through to get this service. So there are a couple of scenarios here. Benefits for a dependent child under the age of 18 are a little different than they are once that child turns 18. So interestingly enough, the child's disability when they're under 18 does not need to be considered when deciding if she qualifies for benefits as a dependent. So if somebody in the household is receiving disability payments or is receiving Social Security payments, that child may qualify for disability under the other individual's work credits, because most children that are getting disability don't have work history to earn those work credits. The child's benefits, and I mentioned this before, will stop at age 18 unless that child is a full-time student in school still, or, and at that point they continue until the age of 19, or if that disability is permanent and is on that list that I mentioned of impairments. Okay. The next is once that child turns 18, but has not reached the age of 22, there's a whole nother category. So these are considered the adult child in the process. See, the adult child, which includes an adopted child, or in some cases, stepchild, grandchild, step-grandchild, must be unmarried, 18 or older, and must have had a disability that started before the age of 22 and met the definition of disability for adults. Lots of things, again, to have to remember, and that's why we encourage you to go on the websites and do some research, and we have some resources and links that we are also offering. Okay, so for example, if a child was receiving benefits at under the age of 18, was labeled disabled, and now is still in high school and they've turned 18, they will continue to receive those benefits till the age of 19. At that point, they have to be reevaluated to see if they meet the adult criteria for disability. Remember, I told you it's two very different processes. As I mentioned, children don't have to earn the work credits, which the adults do, the caregivers credits. So it is called the child's benefit because it's actually paid to the child from the parent's Social Security earnings. And again, that's what's taken out of our paychecks every time we work. So that's the second of the three systems and programs I'm going to talk about. So we're going to now segue into Social Security or supplemental security income. And after that, we're going to talk about some resources to help support your journey. So again, this program is generated through tax revenue. These are not the Social Security taxes that we pay, but they are tax revenues that come out of our paychecks. What are the eligibilities for supplemental security or SSI? So I'm going to use the SSI from now on. So first, an individual must be one of the three: blind, disabled, or 65 and older. And certainly in that case, we know that's just general Social Security that they're going to automatically receive upon the age of 65. But they must also have limited income, limited resources, and must be a US citizen or national, or in one of the categories considered a classified alien. I don't like that term, but that's what the government uses, that is eligible to receive these benefits. So what are the eligibility requirements now for supplemental or SSI? So first, you must be a resident of one of the 50 states, the District of Columbia, or the Northern Mariana Islands. Please don't ask me where they're located. I've not done the geography part on that one. You must not be absent from the country for a full calendar month or for 30 consecutive days or more. In other words, you must be a full-time resident living in your residency for an extended period of time and not be out of that household or that address for 30 days. You must not be confined to an institution at the government's expense. So we're talking about possibly a mental health institution or a prison, because at that point you're not eligible for these benefits. You must apply for any other cash benefits or payments that you may be eligible. For example, if you have pensions, you must have those in place before you apply. If you are getting Social Security benefits, you must have those in place as well. And you are going to have to give Social Security Administration permission to contact any financial institution that you have records with so that they can check on what your financial assets are. At that point, you are now able, once you've met all those eligibility requirements, to file the application. So what does the disabled qualification look like for a child under SSI? So a disabled child as defined by SSI includes any child under the age of 18 who has a medically determinable physical or mental impairment, including an emotional or learning problem that does one of these three things: results in marked and severe functional limitations, can be expected to result in death or has lasted or can be expected to last for a continuous period of not less than 12 months. So we're talking about basically not a short-term disability again, but something that has long-term impact on the child's ability to function. How do you apply for SSI? Well, similar to what you have as options for SSDI, you can apply online at that website. I encourage you to take a picture of the slide to get this information. You can call the 800 number on the disability website. They also have TTY for those that have hard of hearing or are deaf, or you can have somebody call for you, or you can visit in person the local Social Security office. Of course, you want to make an appointment because drop-in is not suggested. The lines are very long, and appointments can take sometimes 2 or 3 hours while you're there. And imagine if they're backed up and you're waiting to get seen. So we really encourage people to make an appointment. Okay, so again, there is a possibility of being denied benefits. How does this look when we're talking about Social Security benefits? So as I mentioned before, everyone has the right to appeal a decision made on your behalf about whether or not you're entitled to benefits. You must request it in writing within 60 days of receiving the decision. There are 4 levels of appeal, and I'm going to go through each of them. Okay, so there's reconsideration. Reconsideration is when you will ask them to review your application. You may submit more documentation to back up more if they have questions. And if they've reviewed it and decided, you know what, with the additional backup, we will go ahead and make you eligible. Administrative law judge. That is, of course, a judge that has been assigned to cases to review for the Social Security Administration. Again, they may ask for additional documentation. They may want you to plead your case as to why you believe you're disabled and meet the criteria. The third is review by their appeals counsel. So again, you would have to submit a request, and they would have a council of individuals who had been selected by the Social Security Administration, who would listen to the case, review the documentation, and make a decision. And finally, there are federal courts. If you feel that it's important to have it brought through that process, there is a federal court review process. You would have to appeal all of these decisions in writing, but you can request an appeal online for the reconsideration, for the hearing with the administrative law judge, and a review for the appeals council. Even if you live outside of the United States, you are still eligible to appeal it. When the Social Security Administration first sends you the letter explaining their determination is when you will be notified what process would work for your case, and it will give you the level of guidance that you're going to need for which level of appeal that you're going to decide on. So it will be all in writing once you've been given that consideration of denial. And that pretty much wraps up in a kind of a very quick overview, 3 federal government programs, but I am going to share with you some resources that we have here at FND, and I think that we would encourage you to absolutely engage our organization to find out how we can support you and your family. But I do want you to look at our slide. We have 4 divisions in our Family Network on Disabilities organization. So we have our 3 parent training information centers that are mandated through the IDEA law, which is the Individuals with Disabilities Education Act law. Fortunate in Florida to have 3. And all 3 of them being housed under the FND umbrella helps us to maximize our resources, our impact, and our ability to serve families. So we have Pop-In, which Kathy is the director of. Kathy, are you on camera yet? Are you coming back on, or?
Your video is highlighted, but I am on the call.
Okay, so Kathy Powell is the director of Pop-In, Parents Offering
Parents
Information and Networking, and she has the pretty much the northern part of the state of Florida territory. And then we have PSN, which is the Parent Support Network, which, as you can see, is sort of the southwest part of the state of Florida, if you can see that on the Florida map on there. And then we have PEN, which is Parent Education Network, which is the south and the east part of the coast of Florida. And all three of those work to support families, and they support those children through the age of 22 while they're in school. And that support can be helping understand the IEP system, trainings, resource linkage, and peer support, as we do for all of our programs. And then finally, we have the Family STAR program. STAR stands for Support, Training, Assistance, and Resources. That is a statewide grant that we have, and that grant offers resources, support, training, and assistance for families that have children with complex medical conditions, special healthcare needs, developmental disabilities, or any type of mental health challenges. And we work with those individuals till their child is age 26. So with the pop-in, PSN, and PEN, it's through to age 22. With Family STAR, it's to age 26. And on this slide, and I encourage you to take a picture of this slide as well, so you'll have the links and the resource information. You can see our website, fndusa.org. We have a whole host of resources on our website, and I truly, truly encourage you to check us out. We have them in 2 languages currently, English and Spanish. We have them printable and downloadable so that you can take them to appointments or meetings and team meetings with providers throughout your systems to share information. We have guidance and trainings on our Facebook pages. We also are on Instagram and Twitter. And we have F&D University, which is a non-accredited e-learning program that you can go on your own capacity and speed and do some training so that you can be a strong advocate for your child in the system of care. And finally, this is how you can reach us by phone and by email. So our phone number is 800-825-5736. Our email is fnd@fndusa.org. Although you see our address for our headquarters is in Clearwater, we have staff all over the state of Florida working remotely and within all of the communities that we serve to support families, professionals, and providers with any type of resource that we can help to make their journey easier. So that's my presentation this evening. We have put